I am with Iveta Nagyova. You are part of the panel and as a speaker of this wonderful summit that is attending now in Paris for the IPs.
Yes.
And I was so impressed about your speech this morning when you brought all the abilities that a human being, because we are involved in the well-being of human, this
Yeah.
is our main purpose, that how you can benefit altogether part of when you implement, the new lifestyle and the new approaches in integrative medicine, then this is your mission. Iveta, can you explain more what is your main purpose and why you are now president of the UFA?
Yeah, maybe I have to start in the beginning.
Yes, for sure.
You asked me what is my original training, and my original training is clinical psychology. But I wanted to study originally medicine. But then I, thought that psychology is far more interesting because how people think and how they make decisions and so on. So I went to study psychology. But I was not really content there, so I was looking for some possibilities to go back to medicine, and there was a wonderful opportunity at PJ Šafarík University in Košice, Slovakia, to collaborate with the University of Groningen in the field of chronic diseases, quality of life of patients with rheumatoid arthritis. And I thought that it's a wonderful opportunity to bring together what I studied with what I wanted to originally study. So I started to do a PhD, and since then I started to work in the field of chronic diseases, quality of life in people with chronic conditions. I was paid then by the University of Groningen to supervise PhD students in this topic. And we came to several chronic conditions. So I started with rheumatoid arthritis, then we had multiple sclerosis, some Parkinson's disease, people with coronary artery disease, end-stage renal disease, so different conditions. And I just realized that all the patients are suffering from very similar problems. They are losing sometimes their jobs or have difficulties at jobs. They have to deal with marital problems, relationship problems when they have chronic conditions. They have to deal with treatment adherence. So this is actually what brought me also to UFA, to see the broader view of chronic conditions and the things which are common for people.
Yeah, and we know also that with the burden disease, there is so much impact that we want to change. We wish people to have more consciousness in the way they can take care of themselves,
Yes.
And this is what you promote with the UFA and all your background.
Absolutely, yes, because the public health community is or has been very rigid and old-fashioned. So for them, public health was originally only prevention or infectious disease or hygiene. But because I had this broader view, because I had the background in psychology, I was dreaming about, bringing also chronic diseases to public health community. Originally in 2006, they told me it's not a public health issue. So it was very interesting that I had to change the mindset also of this European public health community. Yeah, and then we are here at the NPI conference, the Non-Pharmacological Interventions, and I think it's the next step because now the public health community understands that chronic diseases are important and relevant, and it's a big issue and one of the biggest health challenges. But what can be done about it? We are not very efficient how we are tackling chronic conditions. Pharmacological treatment is not enough, and also we have overburdened, overstretched healthcare systems. We have rise in chronic conditions, and there is no more money coming to the system. So we have to be very innovative, and I really believe in non-pharmacological interventions, that they can be part of the solution.
In all the researches that I'm doing, I'm sharing exactly the same vision. I think we are at a turning point where we really need, knowing that the healthcare system is suffering so much,
Yes.
so much cost, the effectiveness is it's like becoming too big and too impossible to make the accessibility. And we also are observing that people needs other kind of intervention to be able to have a better understanding of their body, their mindset.
Yes.
And this is what all the IP can bring, you know, to
Yes.
the protocol, you know.
Right, right. And we have to raise awareness in the public health community because they were not aware basically of that. They did not realize that there is this whole group of people who are doing evidence-based research on non-pharmacological interventions, on behavioral interventions, salutogenic interventions. There are many terms explaining or expressing the same thing. So basically how you can help people to live more healthy lives, to be more physically active, to eat more healthy, or maybe to enjoy life as well. And we discussed previously during the break that also design, architecture, culture are also a relevant part of that because they are influencing health and brain in a very positive way. So
actually, I embrace, you know, many years into the heart business, you know, developing some kind of activities to make the artists, you know, visible. And it's something that was so obvious for me that when you live in a beautiful surrounding
Yes.
and some form and shapes, like the picture of the hospital you showed this morning, you know, it's kind of bringing the brain into another perception and vision. And I'm sure it's creating new neural pathways.
Absolutely.
In the,
and so far, till recently, well, actually, behavioral medicine is a relatively new field. It was established in 1970s, and we, like psychologists, we somehow understood that, let's say, if people are happy, they have also better immune system and so on. But there was not enough research for that. But currently we have it. So there is research which proves that beauty and architecture and the beautiful things are releasing oxytocin and all other very beneficial things in the brain. So they are very, very good for the brain.
Oh, for me, it's I'm sold to that, you know. It's like it should be like that. There is so many things we could create, you know, like ecosystem where people can gather, shared, and also have some place, you know, to receive the IPAs, for example, you know, like a different place where we can conceptual environment where people will be able to go.
Yes. Yes, but not only that, but when we talk about behavioral science and behavior change, again, we have to think about how we design buildings so that people see as the first thing stairs, not the elevators, and then we promote physical activity. It's called choice architecture, so it is a very interesting concept to make the healthy choices to be the easier choices for people.
Exactly, it has to be simple.
It has to be simple.
This is what I'm sharing with the majority of people, and just to know more about how your body can react, and sometimes not to make it too complicated.
Yes.
Because some people, when you ask them to go out of their comfort zone, they are maybe shaking a little bit and say, oh, it's going to ask me many effort, and you just go slowly and bring the person to shift into the way they can view themselves, into the change, you know, in the transformative way.
Right.
And they will see the benefit on their health, you know, and then this can be applied even into like for treatment. Let's say with the new protocol they brought with the livre blanc, you know, that you, did you see
the
it?
white,
the white book, exactly. But also into preventive protocol, you know, that people could have in their life and to stay healthier.
Yes, so NPIs are relevant especially for people with chronic conditions already, because when we can help them to adhere to recommendations from medical doctors, for example, to treatment recommendations or lifestyle recommendations to eat more healthy, to be more physically active. But again, it has to be simple, it has to be easy for the patients to do that. So we can also improve again the mental health status of the people, and this in return is improving the physical health of the people. So it's like feedback loops, which is very, very relevant. Therefore, I'm such a believer in non-pharmacological interventions because it can bring real outcomes, real results, real improvements for the patient with regard to health status, but also quality of life, mental well-being, which is also very important.
For sure. So interesting to share with you, Iveta, and speak. And I hope we will have the chance another moment to do it. And maybe I'll visit you in Slovakia.
Yes, please, you are invited.
Yeah.
And also you can come to the UFA conference. It's a big event. 3,000 people will be present this year in Lisbon. And it's one of the biggest conferences in the world with regard to the program.
Actually, I won't be able to attend this year, but it's in Helsinki.
In Helsinki,
yeah,
yes.
I think
next year.
This one
next
I will
year.
be able to attend. Yeah.
Perfect. We are looking forward to it. It's a very, very diverse program. So all public health topics are covered. We have 11 tracks and 16 parallel sessions for the 3 days. So a lot of activities.
Yeah. You know, one of my topics when I do my conferences is about all the input we should put in the mental health issues, you know. I share with you this morning, I was in Washington, D.C. for the integrative medicine for mental health. And there was all these people sharing like similar summit and IPIs, but specifically for mental health.
And we have to use the momentum because the WHO just adopted, or countries adopted the WHO resolution on behavioral and cultural insights at the European level in 2022 and in 2023 at the global level. So it's the behavioral sciences for better health. So it means that every country, every government in the world committed themselves to implement more behavioral science, behavioral medicine into healthcare to improve the health of the populations. So we should use the time, the opportunity, this window.
Where are they based, this group?
It's the WHO, the World Health Organization in Geneva and the European in Copenhagen.
I didn't understand
So the WHO. So it's very good because then you have a political commitment and the countries need to invest also money into that. So that's a big achievement.
Fantastic.
Yes.
So pleased. Humanity needs it, you know, to put the lens into these all these possibilities that are so empowering for the human being.
Right. Yeah. Absolutely.
Thank you, Iveta.
With a great pleasure. Yeah. Thank you very much for inviting me for this interview. It was very pleasant.
Yeah. Thank you.